Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Ishwar Amalazari, gastroenterologist at Sparsh Hospital, Bengaluru, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Hi everyone, I am Dr. Ishwar Amalazari, consultant medical gastroenterologist and hepatologist, interventional endoscopist in Sparsh Hospital, Yeshwanthpur, Bangalore.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
So basically, IBS is a functional disorder. It is not a disease. So it is mechanism wise, there is a disturbance in gut brain axis, basically, and alteration in the microbiota, microbial dysbiosis that leads to the symptoms in a patient. So, as a Rome criteria said, so basically defined the patient whoever having recurrent abdominal pain in last 6 months and more than once day in a week for 3 months with more than two symptoms of it is associated with basically the defecation, it is associated with frequency of the stools, and it is associated with basically form of the stools. So whichever there is a change along with abdominal pain, and we had to define them as an IBS. And other things we should keep in mind that we should most of the time ask for the red flag signs to rule out other disorders. So if there is no red flag signs, patient in meeting this criteria, we can define them as an IBS patients.
Why do you think IBS remains one of the most underdiagnosed gut conditions in India?
So basically, it is underdiagnosed because the proper approach in primary healthcare setups and basically physicians, the lack of complete knowledge regarding the IBS that make most of the time the it is underdiagnosed. And another thing is most of the time patients in Indian scenarios they neglect. They think the symptoms are okay, fine, they are fine to live with these things, so they are not going to be much problematic for them, even though that is affecting their routine activities and quality of the life, but most of the time they ignore these symptoms. So because of these issues, Indian scenario, we are underdiagnosing IBS.
How does modern lifestyle, food habits, stress, and sleep contribute to IBS?
So basically, the incidence of in public population IBS is day by day it is increasing, mostly because of it is lifestyle related issues. So first in lifestyle, what comes is always the food habits and what we usually eat and what time we will eat. And another thing is basically the sedentary lifestyle, lack of regular exercises, and another thing is the stress and inadequate sleep. These are all come under lifestyle, so that are all contributing to the increase in incidence of IBS in general populations now.
How important is the patient's history compared to investigations in IBS diagnosis?
So basically, I would like to say that IBS is a clinical diagnosis. It is not a investigation based diagnosis. It is completely the clinical based diagnosis. It is depending on the patient history. One, we should, as a clinician, we should go in detail and take a history and also ask for the red flag signs in a patient. If it is not there, they are meeting for the criteria of IBS, then definitely we can diagnose these patients on clinical basis. No need of any invasive test or even lab test also.
How often do you see IBS overlapping with anxiety or depression, and how do you address it?
As I already told, the IBS is basically the gut brain axis in coordination and dysfunction. So, whenever the patient is having depression and anxiety, about 30% of the patients will have IBS symptoms. Or, in other way, whoever having IBS symptoms, there is an underlying depression or anxiety disorders are most common. On an average, in our OPDs, busy OPD, we can see around and 30% of the patients will have this condition together.
Once IBS is diagnosed, what is your first line approach to management?
So whenever we diagnose the clinically the patient as a IBS, so first our approach should be always to the lifestyle modifications, and we should take deep history of their diet and their lifestyle and their activity, daily activities, all that things is we have to be fix them first. If we are not fixing them, the treatment is incomplete. Most of the time it is related to their lifestyle. And next we have to be approached with the medications and according to the need and type of IBS.
How do you tailor treatment between IBS-D, IBS-C, and mixed IBS?
We classify IBS as a IBS diarrhea, IBS constipation, IBS mixed type, and sometimes unspecified also. So basically, what happens in the case patients who are having IBS diarrhea, we have to be look for any lactose intolerance or patient is having any SIBO or any other under secondary causes for diarrhea. We have to be rule out them, and then we should tell the patient to avoid the dairy products, caffeine, caffeinated foods, whatever the things are there, and also we have to be tell them to decrease the FODMAP food, that is whichever containing high FODMAP in their food. So we should tell them to avoid the FODMAP whoever patient is having diarrhea predominant symptoms. In patients who are having the constipation, so we should tell patients of constipation, we should tell them to increase the water content and increase the soluble fiber having foods, and also we should tell the patients to have adequate exercise on regular basis, and we should tell the patients to avoid stress and sleep related issues because that will affect most of the time the bowel movements. They will develop the constipated related symptoms. And whoever patient is having the mixed type of problem, so we have to be identify which is most of the time the common in their symptoms and what are the problems in their diet. We have to look for the things and then we have to be customized accordingly and according to the situation how they face the problems.
How do you balance pharmacologic and non-pharmacologic management approaches in IBS?
As I already told, basically pharmacological management when it comes after lifestyle modifications. Once we given adequate knowledge and adequate counseling regarding their diet, followed by we have to be start on pharmacological medications. It is all depending on the how severe the symptoms are. So basically, at this scenario, we have definitive and well treatable pharmacological therapies both for IBS diarrhea and IBS constipations. So we have to go with pharmacological therapy once we completely fix their lifestyle modifications.
What are some practical ways physicians can build patient trust in IBS treatment?
So basically, what happens whenever patients comes with IBS symptoms, physicians most of the time don't give much of time to their taking in history and counseling the patient. So basically, what happens that will build a misunderstanding in treating the patient. So first, we should do one thing. We have to counseling thoroughly for a patient regarding this condition, what it is exactly, why it is coming, what the problems are, what's their lifestyle contributing to their issues. And then we have to be tell them what lifestyle modification to that particular patient should be done, and followed by what are the pharmacological therapies. And main thing is we have to try to avoid the misconception. We have to be explain them what are the misconception what patient already has in their mind, and we have to clarify them. We have to be clearly tell them that this IBS can be well treated and it is well manageable. Then the patient will rely on the physician's counseling.
What advice do you give to patients for long-term gut health and relapse prevention?
First, we have to maintain good gut health, that will maintain a good gut brain axis. So basically, we have to do the first food, whichever the food is having most of the time FODMAP diet, and we will get in the online whoever go through it, and then we should avoid that food. Most of the time, that will worsen our IBS symptoms. And next is we have to be do regular exercises. We have to include well and good soluble fiber diet in our routine food. And also we have to avoid stress and anxiety. Most of the time that will fix our gut health, and indirectly that will help in controlling the IBS symptoms. Thank you.
Thank you, doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert led conversations. Until then, take care and prioritize your gut health.